Hi, everyone. I'm here with Jeff Wessinger from PointClick Care, and we're here talking today about COVID-19 and the PointClick Care real-world data capabilities. Why don't we start by uh, asking Jeff a little bit about his role at PointClick Care. I know he leads the Lighthouse Initiative, and maybe he can tell a bit about how that came about.
Yeah, sure. Yeah, thanks, Dan. Great to be here. Yeah, my name's Jeff Wessinger. I am with PointClick Care, and as Dan said, I lead the Lighthouse Initiative. What that is an initiative to take the EHR data from our database, which is focused on long-term healthcare, and make that data available to life sciences companies for the purpose of real-world evidence research. So PointClick Care historically has been in the EMR business, but oddly enough, in the 25 years that they've been running, had not considered the idea of taking this to life sciences, obviously to providers, hospital systems and to their customers, but not yet to life sciences. So over the last couple of years, we've developed a strategy to get the appropriate BAAs in place with our customers to do right by them, and then to put this data set together, curate the data so that it would be relevant for research. So my role is to head up that commercial endeavor for PCC.
So maybe we'll step back, and can you give us a feel for what PointClick Care is and what kind
Sure.
of use clinicians use it for?
Yeah. So, it's PointClick Care is a privately owned Canadian company. They got into the SaaS software game very early. So they created both a SaaS offering and a associated pricing model that worked very well for long-term healthcare. So if you know anything about industry and skilled nursing homes specifically, most of what they buy is on a per resident day basis. And so to align with that buying model, PointClick Care created a pricing option that priced their software on a per resident day basis. So for pennies per resident day, they can equip themselves with everything they needed from a software perspective. Effectively, it becomes the ERP for their facility, right? So everything from billing, trust management, care management, everything that the facility needs in order to operate and take care for their patients is provided there. So, in the last 25 years, they've managed to capture about 70% plus of the skilled nursing facility market, about 60% of the assisted living market, and have recently entered into the home care market, which is an emerging market. A lot of players there yet, but intend to be a leader in that space as well. So as I said, because of that robust data set and the types of patients that are in it, the idea to create a novel offering from the EMR patient data is where Lighthouse comes in. And we feel that data fills a critical gap between the ambulatory care EMRs and the acute care AMRs that hasn't been served in the market before. So now we can track these patients longitudinally across a longer continuum. So that's where PCC intends to enter this patient data space.
And as we all know, COVID-19 is probably the dominant issue of our times. Tell us more about what's in the data set you have around COVID-19 and why it might be enriched in a different way than other data sets.
Yeah, as I said, it's a completely unique data set to what you would see in acute care or ambulatory care. Obviously, as it relates to COVID, you might consider that long-term care was the epicenter, at least in the U.S., for this disease. So and if it's not the epicenter, it's definitely been disproportionately impacted versus the general population. So we have a very high-risk population in general, and then we have a high-density environment. We have from a comorbidities perspective, we have an average of 8 comorbidities for any of these patients. So it's it's definitely no coincidence that we've had a significant impact. So the database, as of a couple of days ago, we have 135 patients that have been diagnosed with COVID-19, and we have at least one case in over 4,300 of the facilities that we serve so far. So a very high percentage, which is not good, obviously, from an industry or facility perspective, but tends to be very good for anybody that's looking to research this type of patient. So, we are working closely with a number of organizations to do specific research on this important area. And hopefully we can do some good with it.
So did I catch it correctly? You said 135 or 135,000?
Sorry, 135,000 patients and 4,300 facilities that have at least one patient.
Wow, that's quite a lot of data.
Yeah.
What sort of unique information is available in that data set?
So we obviously, as most EMRs do, we have a very detailed and extensive patient record. The unique part about a long-term care database is that we have longer stays than would generally be there for acute care. And so, what you see is that you've got therapy and treatment information that include very detailed care plans. So plans that aren't necessarily, go for surgery, but over a longer period of time, this is how we're going to care for the patient. Now that includes not just medication administration, but other daily activities, that care professionals would undertake. And it's very specific and outlined for them. So they very much follow a plan for each patient. So we've got that. And then on the other hand, we also have, very detailed outcomes, again, at very small intervals, almost at the shift level. So you can measure vitals over times smaller than days. You can measure incidents that happen with these residents. Other specific assessments, like a typical one in long-term care, is an activities for daily living score that measures the ability for the resident to conduct their own, daily activities, like ambulating or using the bathroom or being able to dress themselves. These kinds of scores are typical in these assessments. Other detailed assessments like cognitive screeners, other screening tools are all available as well. So you tend to have a very detailed level of therapy data and a much more detailed level of outcomes that can be measured. And again, because of the long-term nature of these stays, you can study patients on a longer scale longitudinally than is typically available.
You've been working with some groups like Mayo Clinic, CDC. Tell me more about what groups are already trying to do with the anonymized data.
Yeah, so there's been obviously a lot of groups that have approached us. A lot of people have approached us to get their hands on this data, specifically the COVID patients. So Mayo Clinic specifically is a study by them is looking at understanding post-ICU outcomes. So after they leave the hospital, what type of outcomes are they dealing with, post-COVID, post being in that intensive environment. So there's a big study that we're helping with there. The CDC and then more broadly CMS and HHS are looking to understand the disease, progression. They're looking at mortality rates within nursing homes. They're really looking to understand in general how it's impacting these homes and how they might create guidelines, to better aid these organizations down the road. And maybe even apply some legislation based on that research. So we are providing data to those organizations. Other life sciences organizations have also inquired, and some are already using the data set with the COVID diagnosis as an extra parameter. But yeah, our intention is to help as many of these organizations as we can to better understand this disease and how to deal with it.
And what have you seen out there that is exciting in terms of real world studies and research around COVID-19 beyond what you're already doing?
Yeah, so the obvious one, if you look at what pharma companies want to do with their existing therapies, so if they've got products that are already in line or available in the market, what's the impact that they're having on this disease, right? So if there are patients that are already on either your vaccine or your therapy, maybe it's not indicated obviously for COVID, but to see if there are any correlations. So if you do have a correlation or a better mortality rate, like we saw potentially with the BCG vaccine or hydrochloroquine, those are two examples of some that have been studied extensively, but really anybody that has a drug that's out there that we can look at and see if we get a change in outcomes that's significant, from the baseline. I think that's the interesting and I think most obvious use case that we're seeing.
I am curious, do you have a way to determine mortality, or is that a tricky variable? Because I know that's hard in a lot of data sets.
Yeah, I mean, obviously we have it, I think, in terms of providing it, certainly to government organizations like HHS and CDC, we can provide it. I think we can provide it, I know we can provide it in aggregate form, and specifically for studies like this, that's how it would be provided. But yeah, we definitely have the attribute, but depending on expert opinion, we may not be able to provide it, longitudinally at a specific patient level.
Great. And what else do you envision groups doing with the PointClickCare data? A little bit maybe beyond what you've seen so far. You've been planning on this for a while.
Yeah, I think obviously because of the demographic, I think you can look at diseases that disproportionately impact this population as areas that we would look at. So I think top of the list is neurologic disorders, whether that's Parkinson's or Alzheimer's, or I think more broadly dementia in general. I think those are areas that we have a very robust set of patients that could help with that research. So that one seems obvious, but not limited to those. So cardiology, respirology, diabetes, immunology, and even some rare diseases that impact this population, I think would be areas that we would definitely see interest in, and we have customers using it for. The second thing is because we're not just a data set. As I explained, PointClick Care is first and foremost an EHR. So prospective studies and the ability to use our custom assessments and forms for putting out screening tools, for putting out specific care plans by disease. I think that's an area where pharma companies can create their own data sets, right? So they can, at once, they can give back by providing the screener, providing the therapy description and what makes the most sense, and then also get back the data from, that specific assessment, which will help them enhance in the future. So we're already doing that with a couple of customers, Acadia with their PDP screening tool, and we look forward to doing that with many other pharma companies in the future. And then lastly, I think where we're just starting to look at opportunities is for clinical trial recruitment. So obviously there's a complicating factor in terms of privacy and notifying the patient that there's a clinical trial, but I think we have some really good ideas about how we can do that notification and still respect that. And I think there's a tremendous opportunity to get patients involved early on in some of the new research that's happening. So those are the three areas that I think we look forward to participating in moving forward.
Great. Well, Jeff, it's been excellent having you on. We're looking forward here at Graticule and partnering with PointClick Care. I think there's lots of opportunity, and especially in COVID for the short term, but in the long term, these sound like great concepts. So
awesome.
Thanks for taking the time.
All right. Thanks for having me.
All right. Catch you soon.
Thanks, guys.
Bye.